Hi, we're Team popEYE and we're very excited to present our application for the Pop Health Developer Challenge. Uh, popEYE is an extension of the Pop Health framework and system, and basically what it tries to do is that help increase the utilization of preventive services, as it is widely known and reported that utilization of preventive services is less than desired in primary care offices. So assume I'm John Smith and I work at the Horizon Clinic, which is part of the General Hospital, and I'm very, very interested in knowing the colorectal cancer screening rates in my clinic. So I can use the tool like Pop Health, which is a great tool and quickly summarizes all the numbers for my patient population based on the meaningful use measures. And I can see only 39 out of 103 potentially eligible patients have received colorectal cancer screening. So this is where most query reporting, disease management, even systems including Pop Health stop. And the burden falls on the provider, the clinic, the nurses to actually manually follow up on the other odd 60 patients who have not had colorectal cancer screening. And they have to either call them, send postcards, letters, and this is where the ball drops. So we're very excited about popEYE because popEYE can solve this problem and ease the burden on the practices. What popEYE does is that it allows the provider, the doctor or the nurse in the practice to set intelligent reminders, voice reminders that are sent, delivered by popEYE to the patient's phone. And for each measure, and the provider can select whether the reminder is for somebody who's in the numerator. For example, if they want to just call patients who have had colorectal cancer and give them some other information. But let's say for now, John Smith is where I am very interested in calling all those patients who have never been screened for colorectal cancer screening. So I can set this reminder for them, and popEYE also allows me to get a response from the patient once the call goes in. I'm interested, connect me to clinic. So they can call our clinic live right from the phone call that popEYE will make and schedule an appointment. I'm not interested. Patients can choose, press the number 2 button and say they're not interested. And we also give an option to opt out of such preventive service reminders in the future. I want popEYE to only call my patients between 9 to 5 p.m. And another intelligent thing and useful thing about popEYE is that it allows, it can make follow-up calls to patients if they don't respond in the first time, and it can do up to 2 follow-up calls. So I can, within less than a few minutes, specify a reminder for a particular measure, and as you can see, it's gone through. And once I create it, the next step for me is to test how this reminder works. So the reminder has been set. Now I can test how popEYE will actually render this and deliver this message to the patient. So I test it and I'm putting in my cell phone number, and now popEYE will actually call my phone and tell me about this message from the physician. So any moment my phone should ring. There you go. popEYE is actually calling my phone, and when I answer,
Call from Dr. John Smith at Horizon Clinic.
it's actually reading out
This
the clinic
message
name.
colorectal screening.
It's actually automatically
Please
reading the
select
screening
from the
measure,
following options.
and it's
If
going to
interested in
specify,
connecting me to clinic, press 1.
it
No, I am not
spelled out
interested.
my
Press
options.
2. Opt out. Press 3. If you want to leave a message, press 4.
So I can now actually select one, and then once the option has been made, the system would call and connect me to the practice to actually schedule an appointment. So that's how the test call works. Once I make the test call, system is live, and then it shows me this dashboard of how many calls have been made, how many responses have been achieved, and how many patients have not answered. So in less than 5 minutes, I've been able to set a reminder and actually test how the reminder works. And now I can track this dashboard, and popEYE will go and start making calls, and it will make calls to all the 60 patients. If I had thousands of patients, it will make call to all these thousands of patients. And similarly, I can set up calls for reminders for other measures. Let's say I want to set reminders for people who have had smoking and tobacco cessation counseling. I want to call and find out from all those patients who've had cessation counseling if they have quit or they have not quit. So now I have a smoking reminder, and it will only go to those patients who qualify for the smoking criteria. So like this, I can set up different reminders and automate the process of following up with those specific patients. And all these calls go in the name of my clinic and provide patients an option to follow up with us and give us a response, and I can track them. We are very excited about popEYE, and we think it can really increase service utilization by providers and save their time and save their cost of sending out mailers and postcards. Thank you.